I'm delighted to introduce Jacqui Fletcher, Clinical Lead for Tissue Viability at NHS England, who's going to be talking about the theme of this year's Stop the Pressure, which is what matters to me. And it's really about person-centred pressure ulcer prevention, irrespective of care setting. So over to you, Jacqui. Hopefully she's with us from Boston.
Hello and welcome to Stop the Pressure Day 2025. My name is Jacqui Fletcher. I'm the Clinical Lead for Tissue Viability for NHS England. I'm presenting today on behalf of the Four Nations team who've been responsible for putting this campaign together. As with every year, it's important to remember why we're here and why we're doing this. Pressure ulcers are one of those things that don't discriminate. They affect everybody from birth to death in every type of care setting, whether that's in someone's own home, in receipt of healthcare, in emergency care systems, in hospices, wherever they may be. And importantly, they don't always appear whilst under clinical care. We see many people who come to us having developed pressure ulcers at home, being cared for by their family and their relatives. This is not about blaming those people. This is about people doing their very best to care for those that they love, but not always having the knowledge or understanding or the ability to prevent harm occurring. And it's really important that we remember that this isn't a safeguarding issue. This is about people being supported to do the best they can for the person that they love and care for. It's also important that we remember that people frequently move between care settings, so that every point of care, whether that's a health carer, a social carer, or a family member, friend, or relative, offers consistent, well-communicated, evidence-based care and support. So this year, our theme for Stop the Pressure is what matters to me is. And for this year, the Four Nations team is turning the spotlight on the patient voice. And we're thinking about the different places that they may be being cared for, starting with that front door to many acute care sessions, the accident and emergency department, including within that our paramedic services, because they are very much part of that care. Thinking about delivery of care in hospital wards, in care homes and home care settings, and also at end-of-life care situations. But also everything in between. People touch many different clinical groups when we're talking about pressure ulcer prevention. So we typically focus on community nurses and hospital nurses, but let's not forget they see physiotherapists and occupational therapists, podiatrists, GPs, practice nurses, and a whole range of other people. And we need to make sure that everybody knows what's important. So we are posing on social media that question to both patients and to clinicians, because I think it's important that we remember for clinicians, this is something that really affects them as well. What matters to you in this moment and in this place where you are? What is your priority? Because whilst pressure ulcers are our priority, they're not always everybody else's. And if you're in a life-threatening situation, if you're in terrible pain, if you're very anxious, it may not be top of your mind. So we need to think about how we make this work for people. And this is building on work we've done previously. So you may recall that 2 years ago, we started with our focus on every contact counted. And I've mentioned already lots of different clinicians. I've mentioned the paramedics and the therapists and the practice nurses, those people working in care homes and other forms of social care. We need to remember that those people are also very important in preventing pressure ulcers. It's not just about the community nurse or the ward nurse, and it's definitely not just about the tissue viability nurse. To build on that, last year we focused on inclusivity, remembering that not everybody thinks in the same way, reads in the same way, acts in the same way. And we need to support them thinking about the right choices, about equity and respect and understanding neurodiversity and other things that may influence what people do. And that's all come together this year to focus on this campaign of about what matters to me. It's about thinking about the individual, what their wants and needs are, speaking to them with honesty, maintaining dignity and respect, collaborating, being kind, and thinking about what really matters in that moment, in that place. So it's a reminder of our need for vigilance, for training, and for patient empowerment. It encourages clinicians, carers, and patients themselves to recognise early signs of pressure damage, to think about what they can do in terms of prevention strategies and understand what's appropriate in that time and place, and particularly thinking about how we may address inequalities that affect the outcomes for those patients. So If you're unsure about what the difference between patient-centred care and person-centred care is, I think it's really important that we explore that, because fundamentally that's what we're talking about when we're thinking about what matters to me as a patient or to me as a clinician. Patient-centred care focuses primarily on the individual seeking care, so they're already a patient, and what we focus on their medical needs and preferences. So it's about saying we need to do this repositioning schedule for you, and how do you fit around that? Whereas person-centred care is much broader. It acknowledges that individuals have differing abilities, preferences, values and needs. And as well as including their health, it thinks about the health of their communities and their role in shaping healthcare delivery. It recognises that each of them have unique needs and wants, and we fit the healthcare around that. So it recognises the total person, part of which is a need for something related to their current health and medical need. So we put the person before we put the medical condition. So it's really about the difference between delivering care to or for a patient. We need to do this for you. I need to do this to you. And delivering care with a patient and their families, friends and carers. Starting conversations around what do you need today? What are your priorities today? How can we make this work where you are? And seeing them for the person that they are, recognising their strengths and weaknesses, their wants, needs and desires. We also need to focus on the fact that in terms of pressure ulcer prevention, there is strong evidence to support delivery of preventative care actions. In the UK, we have the asking bundle, the assessment of risk, the skin assessment and care, support surface considerations, keeping the person moving, managing increased moisture, nutrition, hydration, and giving of information. And we recognise that giving that bundle of care together can really impact on reducing the number of pressure ulcers that occur. These care bundles are grounded in decades of research and clinical trials, but we know that in practice they don't always happen. And often that's because clinicians say that patients don't concord with a care plan. Now, non-concordance isn't really a thing because concordance means agreement. So if you haven't agreed what the plan is, then you haven't got to the right place. But maybe the reason we talk a lot about non-concordance as clinicians is because we didn't listen closely enough in the first place. So going back to what we've said in the previous 2 years, are we really looking? Are we really listening? Are we hearing what that patient and that family are saying to us about what their priorities are and what their needs are? Because care shouldn't be done to patients, it should be done with them. And our success in preventative care and in maintaining skin integrity really begins with understanding what really matters to those individuals in their own context and adapting the care we deliver to meet those priorities. So it's not just about patients, it's also about clinicians, because we need to think about why there is that discord, why clinicians sometimes believe that it's patients who are non-concordant, and thinking about why don't clinical staff always apply the evidence. And sometimes we can say it's about the lack of knowledge. Frequently at the minute we talk about the lack of staff or time or resource and the lack of know-how or blockers that might be there. But often it's about processes and systems and communication and culture, supporting those individuals who are trying to get it right, trying to do their best to improve outcomes for their patients. Because what matters to almost every single clinician is that they do their best, that they do get it right, and that they improve outcomes for their patients. So this year, as always, we have a huge amount of resources to you. And if you go to the Society of Tissue Viability Stop the Pressure page, you can see that there is this range of things there. That the usual downloadable assets, you can download selfie frames, you can download avatars. There are blogs and videos. There is a link for what's on. So we've got the study day today. We've got a series of webinars. We've got another study day. And we've got lots of videos to show you. We're very involved on social media, so do look out for us. Look for the hashtags Stop the Pressure, 4 Nations, and What Matters to Me. We've got quizzes and games and competitions, and we would really encourage you to enter the competition. This is about, have you created something this year, a resource that encourages your colleagues or your patients or anybody else to get involved, and share that with us, and we will give a prize to the winner. And we've got some top tips on how to communicate, to understand how you can get to the bottom of what matters to individuals. The blogs we've got cover a range of those different care environments we've talked about. So we've got A&E under pressure, we've got seating, we've got paediatric units, we've got commentary from podiatry, we've got the Spinal Cord Injury Association involved, and we've got a lovely blog from two of our colleagues, Heidi and Eva, talking about contractures and postural care, and a link to pressure ulcer development. And I just wanted to share with you one of the short videos. So I think this really emphasises how important it is that we listen to what people say is important to them.
Hello, my name is Chip. I'm 11 years old and I use a wheelchair. Today we're going to talk about pressure ulcers.
Hi, my name is Helen and I am Chip's mum. Chip, do you know what a pressure ulcer is?
Yes.
What is it?
Where someone sits in awkward position for too long, blood circulation stops in a certain spot of your body.
Cool. I don't think I really knew what pressure ulcers were, because I don't think, do you think you've ever had one?
No.
I don't think you have either. And I think you wear AFOs and you use a wheelchair and you use a power chair, but I don't think you've had a pressure ulcer because you are quite mobile, but we don't really know what to look for even if you did have one. I have another question for you, which is, what's important to you when we go to appointments? What is an important thing for you at those appointments?
People talk to me like normal humans.
That's fair. So does it bug you when people talk to me or your carers over your head?
I guess so, yeah.
Yeah. Do you want to know what really annoys me when we go to appointments?
Yes, even though I already know.
What annoys me when we go to appointments?
When doctors go, so, Mum.
It drives me bonkers. Please use my name. My name is on the notes. They can ask my name when we come in. I will always say, hi, I'm Helen. There's one person who gets to call me Mum, which in that room, well, there's two. There's your sister and there's...
Kino. Okay, me, Kino the cat, who doesn't speak English.
Yes. Please use my name in appointments. It drives me bonkers when professionals just be like, so, Mum.
Should we do a role play?
Go.
So, Mum, has Chip had anything?
I'm not your mum!
Mum, it's public.
Sorry. Ask Chip, don't ask me. That's kind of how that goes. So I think that's important, isn't it? That you're treated as an individual and you're spoken to and you're given the information. And also I'm treated as an individual rather than just like the mum. What do you think is a good way to raise awareness about pressure ulcers? Where would you want information to come from?
The internet.
Yeah, I think the internet would be a good place. Social media?
Yeah, but you should always check your GP first to see if it's true.
It's a really good question. I think I would... Okay, sorry, really good point. I think it would be useful, from my perspective, to know about pressure ulcers, the signs to look for from Chip's OTs, from Chip's physios, from the paediatric doctors. It's just not something that's really spoken about, even though you do wear AFOs and you do use a wheelchair. and a walker. So I think that would be really helpful. All right, I think that's probably enough.
Yeah, this is like the 100th take.
Is there anything else you'd like to add?
No.
Okay.
Just love that cheeky giggle there from Chip, and the way that Helen said, "I'm not your mum." But isn't that the important point? Chip's 11, and you can see he's a very bright, intelligent young man. Why wouldn't we be talking to him? And when we are talking to family and carers, it's important that we understand that they want. But I think the most important message there was Helen very clearly articulated the amount of devices that Chip was using. The wheelchair, the powered wheelchair, the AFOs and the walker, all of these potentially causing pressure ulcers, but nobody that they remember has spoken to them about pressure ulcer risk. And I loved the fact that Chip was very aware of the fact that if we're going to use the internet, we should check that it's true first. But that they could list the people that they might have expected to give them information about pressure ulcers. And if you'll note, not one of those was a nurse. It was his physio and his OT and the paediatric doctors. So it sounds like we have a lot of work still to do to get this message across to the right people, so that when the moment is right, when the time is right to have those conversations, both Chip and Helen are made aware of what the risks are, how they can engage with that risk, and what they should be looking for in terms of checking his skin and thinking about, particularly as he's now at that point at 11 where he's about to start growing quite quickly, how that equipment may cause harm to his skin in future. So it's really important that we remember this Stop the Pressure week, but also every other week and every day, that when we're thinking about Stop the Pressure, we have to think about what matters to them. And you can see here we've got a range of avatars. So I've got currently got my X and my LinkedIn profile linked as one of these. You can download them from free. They're in the downloadable assets, and you can have them in black and white, or you can have them with the colour. This year we've taken the year off the Stop the Pressure thing, and we've tried to keep all of our social media components really simple. This is so that we can carry them forward, because we know for you as clinicians, many times printing has a lot of costs associated with it. So we're trying to keep them consistent through the years. One of the elements we do enjoy is seeing the competitive edge in our clinical staff and in the people who are providing care. So we do, as always, have a word search. You can have a paper copy. So if you are running a study day, you can print this off and give it out to people to be doing. But it also runs online. And you might remember in the past, we've had incredibly competitive people sitting up until 2 a.m. trying to beat the time of their colleagues. We've been fortunate this year that Heather Hodgson, one of our Four Nations people, is very creative, and she's created a Stop the Pressure Snakes and Ladders game for you. That again, if you're doing either small group work or working in a clinical area, you can get people to get involved in, and it really prompts them to think about what helps prevention by taking you up a ladder, and those things that you might miss or overlook that send you down that slippery slide backwards in terms of putting your patient at risk. There's also the very popular selfie frame. And if you look at particularly our Facebook feed, you can see Eva Harris has been very busy getting lots of different selfies with this selfie frame. But again, this is something that you can download and you can print out and you can use as you go around your clinical areas to try and get people to get involved in, to think about what it is they're doing. And most importantly, as part of that, we have created this year some pledge cards. Again, you can print them out, you can have them digitally, and we have them in 2 versions. They both say the same things in terms of that text. You can see there that pressure ulcers happen to anyone, that how we work together, and that every action matters. But they differ in that some of them say, I pledge to, and some of them are suitable for use with teams, and they say, we pledge to. So we've had some great pledges in already. You'll start to see these being fed through our social media as we go through the week. And very importantly, this year, rather than ending on Friday, we're going to carry through to next week and the rest of the month and start to give you some information about what we've got in terms of pledges, but also what we've got from our social media questions. The team have been really active in posting questions every day, including Slidos, so that you can vote on what your answers might be or what your comments might be. And we really value that feedback. It will inform perhaps what we do next year and in the following years. But it also helps us to see what's happening out there every single day, so that we manage to keep our campaign grounded and real in practice. So these are just some examples of what you can get from the downloadable assets. We have a range of different posters. They all have very similar text on them. So you can see this is designed for use in paediatrics. We have one for in A&E or theatres. We have one, this looks like end of life care or care of the elderly. You can make them fit to wherever you have to be working. And we have one here specifically that builds into that link between paramedics bringing patients into the emergency department, particularly relevant at this time of year when we're all very aware with winter pressures, that emphasis on corridor care and the changes we're seeing happening with our paramedics being so busy and needing to get back out onto the road. We also have some with facts on, and I think depending on who you're talking to and who you're trying to persuade, it's all important that you have factual information. So you can see we can talk about the costs of care, we can talk about the impact on patients, that increase in mortality for the elderly patient, or if you're working in acute care, the thing that really impacts on your flow is the ability to get patients discharged, and pressure ulcers can result in that increased length of stay. So very importantly for us, Stop the Pressure is about much more than a campaign. It's not just this week. It's a movement. It's about thinking about what we need. It's about who should we involve. It's not just about nurses. It's about every clinician. It's about policymakers. It's about patients and patient advocates, and thinking about how we get them to be engaged in this campaign and others throughout the years that reflect the real lived needs of those individuals. So if you want to participate, we would really welcome anything you can do to support us. So join the campaign via your preferred social media site, and you can see up in the top corner there our links for X, Facebook, Instagram and LinkedIn. And if all you do is like or retweet or comment and share and tag, that would be really helpful. It spreads the words, it shows how important this is. But if you're doing things yourself, whether you're using our resources or not, we'd be really pleased to see what they are. So share your activities and tag us in. Put hashtag Stop the Pressure in there. We will find them. Make your pledge and share them via social media, and do use these hashtags below. Hashtag Stop the Pressure, hashtag What Matters to Me, and hashtag 4Nations. So, as I've said, this is much more than this week. It's really about thinking about how we listen, adapt and deliver appropriate care. Whoever you are, wherever you are, whoever you're caring for and what their needs might be. We want to do our best. We want to stop pressure ulcers occurring. And it's really important that we are aware of what's happening on a day-to-day basis, and we're doing our best to deliver care with patients, not to or for patients. So we hope you join us on this campaign. We're really delighted to have been supported this year by our industry partners, who you can see listed there. Without them and their financial support, we wouldn't be able to do some of the things that we do. So we are truly grateful for the help that they.
Hi, Jacqui.
Good morning, Sarah.
Unbelievable. Honestly, I'd still be snoozing in bed if I was in your shoes. So a huge thank you for joining us live. What a fantastic presentation. And, I think that the video of Helen and Chip is, it sort of speaks volumes, doesn't it, of things we have to think about in terms of the information we give or don't give and conversations we have with patients. So I think everyone probably was affected by that. What a great campaign this year. And at the moment, I'm just wondering if there's there's no specific questions at the moment, but we really need to take on board a lot of what's been discussed this week. I think all of us need to listen more, have different conversations. And as you said, I think in the past, pressure ulcer prevention, it always seemed to sort of sit with nursing, didn't it? But the importance now of that sort of wider multidisciplinary, as you said, it's everyone's job, isn't it? Everyone's role. Do you want to sort of comment on that? Because
It's
I know
everyone's
there's
role.
so many services involved now, isn't there?
There are, and I think, we mentioned paramedics, they're often forgotten, but actually for our patients who are transporting into hospital, they're our first eyes and ears, they're the ones delivering care. Think about all those therapists who might be seeing people when we're not. They might be seeing a podiatrist or a physiotherapist or an occupational therapist for specific rehabilitation needs, but they don't require nursing care. They're the ones who will be involved in that improvement in mobility and functionality. They may be seeing people like Chip when he's not in receipt of nursing care, and they're the ones also very engaged in equipment. So it's important that we have those conversations with them and that we don't think that it's, they're not involved, it's just us.
Yeah, absolutely. And I think that's from my experience, it's there's sort of areas of care that they've never had these conversations about pressure ulcers. It's a bit like the Chip scenario, isn't it? And it's all been a bit siloed in the past, isn't it? Wheelchair services to healthcare provision to other services. But I think we're certainly getting better at of that collaboration, aren't we? Joining up a bit better in terms of pressure ulcer prevention.
I'd be interested to see how many people in the audience are not nurses, what disciplines we've got involved there. So if you are
Maybe
watching
put a
and you
comment.
are an OT or a
Yeah,
podiatrist or somebody we haven't mentioned, say
yeah,
hello in the comments. We'd really like to know who is watching and who is engaging,
yeah,
because
definitely,
it does
definitely.
matter that every contact counts, and we've tried to maintain this thread, haven't we?
We have. So please do, yes, if you are not a nurse. So we've got OT putting into the chat now, Gillian. Yeah.
OT, one
I
OT,
think
thank
though, in
you.
terms of OT, there has been a real shift over the years, hasn't there, in the work that they're involved in pressure ulcer prevention, with all the seating and posture stuff. So that's really reassuring, isn't it, that we've got that sort of wider spread of expertise
Yeah.
now. What else have we got? We've got daycare, day centre worker.
Yes. Oh, some students, that's great to hear.
Yeah,
Hi, Tina.
yeah,
Yeah.
yeah.
Mental health people,
Yeah, so
that's
mental
great.
health, I
A
think.
collection of student nurses, welcome. You're the kind of people we need.
Yes, yeah. Actually, that's a good point. I think you mentioned mental health there, Jacqui. What's happening in mental health settings in terms of this? Because they're again a group that maybe don't always have access to good education. They're not involved in some of these campaigns sort of locally. What's your experience of what's happening in mental health?
I think it's an area where we sometimes fail to reach into, and we do know we have some mental health tissue viability nurse specialists, and they can give really good advice and support. But I think it's the same as in any kind of area at the minute. We're seeing the population within those hospitals and within that care system in the community are getting older. So it's not just a thing where we have younger people, and we see people in mental health units who are very much at risk, either because the condition makes them quite immobile from things like depression, or they are challenged by behaviours that might put them at risk. And there are specific challenges in that management in the same way as we have with patients with dementia or learning disabilities. There are specific needs and requirements, and we need to really listen to what those people are prepared to accept. Listen to the staff in those areas about what works in those areas, what is safe. And I think that's a big issue, isn't it? Where you're working in areas where people have different needs, is around safety and approachability and engagement. So I think it's an area, mental health is an area that we do always tend to forget, and we really need to think about it. We've picked up a lot more recently on dementia care and learning disabilities, but mental health has been very much left behind. So perhaps that's an area we need to think about for next year. So if there are any
Yeah.
mental health people, whether you are working there as a nurse or a therapist, perhaps get in touch with us and we'll see what we can do for you next year.
Yeah, I think that's a really good idea. I know that leading up to this week, Jacqui, there was some concern around the pressures within the NHS. You know, it's not winter pressures anymore, is it? It seems to be pressures all year round, but this particular time of the year, I think it always seems to be worse. And people were being told that any sort of activities around Stop the Pressure Week were maybe having to be cancelled. I mean, we've got a really good attendance today, but there's still things that can be done, even though, you know, maybe there's some pressures within organisations, because that's where the risk is, isn't it?
Absolutely. And I think the more the pressure is, the more the risk is, because whether you're talking about acute or community care, if you're deferring visits in community, if you are concerned about flow through A&E, so we know corridor care is a particular challenge, and our paramedics have gone from cohort nursing to now they can leave after a fairly reduced time. We need to think about the impact that has on the patient's skin, and to say we can't consider that we need to think about preventing pressure ulcers is very short term, because if a patient develops a complication, that increases the workload. So we need to be on top of it. We need to think about how we build our resources around that. And I think there's a limit to how much we can squeeze from our clinical staff, but we hope that you remain very aware of pressure ulcer prevention and that you maintain people's skin integrity. Because it's not just pressure ulcers we're looking at, it is incontinence associated dermatitis, it is skin tears, it is medical adhesive related skin injury. You know, maintaining healthy skin prevents all of those. So if you can keep your patient's skin clean, dry and well hydrated, if you can keep on top of those assessments, looking for early signs, it will make such a difference to that person's quality of life. Because it's not just about that pressure ulcer, it's about the impact that has on them, the risk of complications, infection, whatever that might be. So we do hope that despite the challenges and the pressures within the NHS, you do hope keep this as a priority.
Absolutely, really important words there. I don't think
We've
there's
got a
any
collection
other.
of mental health nurses there.
Yes, yes. So we'll capture that, Jacqui, and certainly I think that would be a really good idea for next year, how we work with mental health organisations, because it is an area I think that maybe there's not been enough focus. You know, as a society, we have run mental health or wound care for mental health practitioners in the past as a study day, and we have included pressure ulcers in that. But yeah, it'd be great to sort of do some joined up working with some of the mental health
Yeah.
trusts. Yeah, definitely. Right,
Yeah,
well,
and I think Chip
Jacqui,
reminded us about paediatrics. We do also have paediatric days.
yes, yeah. So we're running, we always have a study day once a year, a virtual one for wound care on skin health for children. And certainly the paediatric nurses that help shape that program with me always want a fair bit around pressure ulcer prevention on that in that program. So if you are a paediatric nurse, that will be happening this week. I think it's June, the date for the children's study day. But yes, I think it's a theme that should go through most of our study days because pressure ulcers is such an important topic. So I think we added earlier around, you know, we had those pledge cards that Jacqui mentioned.